Hello everybody, welcome back. This is Dr. Marc Dupéré, plastic surgeon in Toronto. I want to thank my patient for agreeing to this filming. I want to show you today upper eyelid surgery, upper blepharoplasty in a man. This is a nice male with a lot of excessive skin. You can see here how much skin we have to deal with. This is not done. I'm going to show you also by pressing on the lower lid, you're going to see the bulging here and here. So central and inner, you're going to see some bulging. Those are fat pads that we often remove in aging eyelids. Those fat pads contribute to the puffiness on the upper lid. Male, I like to put the incision a bit lower on the just above the eyelashes, 6 millimeter above. For ladies, it's 9. And I'm going to show you this side is done to show you the power of this simple procedure, which, by the way, I usually do under local anesthesia with twilight, but this young man is having other surgeries with us today, so he's asleep. This is the amount of skin I was able to remove, a large amount. It's 13 millimeter in height. And the moderate, not so small, fat pads, inner, medial, inner, central, and a small amount of skin in the corner for geometry I like to remove. And this is the final result. You can see this beautiful incision. The stitches are all internal. There's a blue line from the pen at the beginning. The incision is a bit longer than usual because of the marked excess of skin. Thin skin heals super well. We will not see this scar in a month or two. Upper eyelid surgery is a very powerful procedure for rejuvenation that we do here in Toronto for both male and female. The incision is so hard to see that it is by far one of the most common procedures we do on men. Thank you very much for watching.